first cases of myeloma actually occurred in 1844, where before there was myeloma, there was a condition called myelitis osseum, which was a condition where the bones were brittle. So myelitis osseum means brittle bones. And this doctor, Dr. Samuel Sally, was really smart. He was a regular primary care physician. He had two women that are patients of his. One of those women, Sarah Newberry, really had a bad time where she was breaking bones and breaking bones and breaking bones, unlike anything he had seen before. And the smart thing that he did is he wrote a paper. He said, people need to know that this lady is really suffering. If you could go to the next slide. And he actually had drawings made of her showing about how her bones were breaking. And this poor woman in 1844, she was not a rich woman in Great Britain, and they were unable to afford a wheelchair for her. So her husband carried her around from place to place. And actually, when she was stooping over to try, when he had laid her down outside, her back then fell over, and she had this severe pain, and her thighs gave way. She was confined to bed. They gave her the best that they could give her back then. But you can just see how her bones broke and healed and broke and healed, not like osteoporosis, something very different than that. If you go to the next slide.
That was my next question.
I'm sorry.
Yeah, no, that was my next question is like, how is it different from osteoporosis and osteogenesis imperfecta?
Imperfecta is that the bones kept breaking and breaking and breaking, then healing and breaking and breaking and healing and breaking, which, if you have osteoporosis, the bones are just thin and they break. But with this was really a consumptive process. So again, in 1844, they gave her wine and mutton chop, which doesn't sound like a bad dinner, but that was the best that they could do for her. And when they did the autopsy on her, her bones were just paper thin, and a marked destruction and thinning of the bone was noted. And the hypothesis that they had in 1844 is not unlike what myeloma is today. And I think it's incredible how they thought that there was some type of process, some cancer that was destroying the blood with lots of blood vessels and putting out the hardening substance of the bone into the urine, which isn't unlike, we'll talk about how bones and urine are related to myeloma.